Over 1.2 million people died in 2019 as a direct result of antibiotic-resistant bacterial infections. Resistance is now a leading cause of death worldwide, above of HIV and AIDS or malaria in sub-Saharan Africa, which had the highest levels of AMR burden. Young children are at a significant risk. In 2019, 1 in 5 deaths caused by AMR occurred in children under the age of 5, often from previously treatable infections. We are not innovating fast enough to develop effective vaccines, medicines, and treatments, leaving doctors and nurses in every country in the world unable to treat common infections. Poor enforcement of regulations and an unaware public are forming a dangerous alliance, leading to the misuse of antibiotics across the country with devastating consequences. Consequences that are as a result of a phenomenon referred to as antimicrobial resistance within the medical field, or quite simply abbreviated as AMR.
So antibiotics treat bacteria. And for an antibiotic to treat a bacteria, it means that that bacteria is, we use the word susceptible in medicine, but it means it responds to the antibiotic, okay? If the bacteria changes itself, it changes either the way the antibiotic can enter into the bacteria, or it removes the antibiotic once it enters, or it changes its genetic makeup so that this antibiotic can no longer kill or stop this bacteria from multiplying, then we say the bacteria has become resistant. What does that mean for the ordinary person? It means that if you have an infection that is caused by resistant bacteria, then treating that infection becomes more difficult.
If you are exposed to small doses of antibiotics in your system, you may not know until you are at that level when you need to get to be treated for a certain bacteria or microorganism that has developed in you. So if you are not treated or you are given the right dose antibiotics, but then you do not respond, that is the time you discover it will be too late.
Over the years, many more Kenyans have fallen victim to misuse, overuse, or incorrect use of antibiotics, posing a great challenge not just to man, but to plant, animal, and environmental health as well.
If we look at the current resistance rates, you can see that resistance rates have risen from maybe 50% to 78%. So that gives you about a 28% increase in rates of resistance to that particular antibiotic.
With these figures likely to rise in the coming years, if status quo is maintained, policymakers are now racing against time to halt the progression of what has been termed as a pandemic, silently eating at our lives, turning simple hospital visits into medical emergencies that are more often than is realized lead to death.
As a country, we still don't have enough capacity to be able to quantify the burden of AMR. The reason being low utilization of culture requests to be able to identify bacteria that show this kind of resistance. But from the work that we've already started, we are seeing a bit of resistant trends from the culture reports that we're getting from the labs. So it is a problem.
How, though, did we get here? How did a country with one of the best health systems in Africa get to have such high numbers of antimicrobial resistance? One of the reasons, the experts say, is the lack of a standardized policy towards the usage and dispensing of antibiotics.
We have to be stewards. And what does that mean from a policy level? From a policy level, it means antibiotics are only used when indicated. So that means anyone who uses an antibiotic must have been reviewed by a doctor and get a prescription. That pharmacies do not sell antibiotics over the counter without a prescription. That's probably the biggest policy decision we can make. As I said, there are policies, but there's no enforcement. So this has to be enforced, because resistance is not just about me. If I had a resistant bug, everybody around me is at risk of the same resistant bug. So for individuals out there, we have to realize that it's not just about me.
Enforcement, though, is not as easy as it sounds.
We have a mushrooming of very many pharmacy outlets, and that serious competition for business means that some of the operators are willing to put aside the regulations and in order to sell their product, be able to sell it without having to observe the measures that have been put in place. Secondly, I think people themselves feel that they just need a quick fix. Today, I'm telling you, I think we have what I call internet doctors, isn't it? You can Google anything and find out, this is what I have, and you already get a solution for it, and you go and look for that solution. We know what the dangers are of doing that kind of thing, because, nobody's an expert in these things except those people who have been trained in this area.
The National Action Plan was running from 2017.
Without the proper enforceable policies and behavior change, then the fight against AMR would not yield any fruits. And the projections made by individual national governments and global organizations such as the World Health Organization will only get worse, making the attainment of sustainable development goals unachievable. Although a significant percentage of AMR is caused by antibiotics dispensed to and used by humans, experts say there is an alarming rise of inappropriate use of antibiotics among farmers who self-prescribe the drugs to their livestock with no consultation to veterinary practitioners. As a result of this, the danger posed by AMR presents itself in our everyday lives and in the most sacred of spaces, the dinner table.
Sometimes you find antibiotics are being used even where they are not necessary. Livestock production, there's this common thing about dawa ya climate. So you find a farmer wants to move an animal from one area to another, and they think that change may cause the animal to go down with disease. So they insist on getting the animal given a jab of antibiotic. And the worst scenario is where we have farmers buying antibiotics over the counter and administering themselves. We also have the element of unqualified personnel, the ones we refer to as quacks, using antibiotics haphazardly without necessarily understanding what they're doing.
The consequences for this may be unseen to the naked eye, but are equally devastating.
When humans take the food that is laced with residues, they get small doses of the antibiotics in the system. So that exposure brings about the issue of antimicrobial resistance, in the sense that the molecules used in antibiotics are the same molecules that are used for human. For example, the penicillins for animal preparations are the same, streptomycin and many other molecules, they're the same for animals as well as human beings.
There's a distinction that needs to be made. In the event that an animal is undergoing treatment, it's always, you will be advised, one, not to slaughter that animal for food, or if it's milk, you are advised not to use that milk for the duration the animal is under treatment. If it's eggs, the same. Because this, when an animal is sick, there are those the medicine, the drug will be circulating within the systems in the various tissues. Now it becomes an issue, we say is a food safety issue, because those drugs can cause adverse effects to you as you consume.
Lisa Muturi knows all too well about the real-life consequences of AMR, the pain it causes, the economic hole it can lead one into, and ultimately, the meaning of scars of pain left behind by the death of a loved one as a result of AMR. Lisa's husband, Muturi, started developing headaches when he was in high school. These got progressively worse even in adulthood, and despite numerous visits to specialists, nobody could make a diagnosis that would get rid of the pain. For more than a decade, he managed the pain rather successfully until in 2009 when it became worse, affecting even his balance.
He used to walk very fast and he could trip. He would almost fall, but okay, he used to gain his balance and go on, but he could go to work, and then when he gets out of the vehicle, he couldn't just get out of the vehicle and start walking. He'd feel the legs are numb. So he'd have to stand for some time and then now go.
After this episode, the family decided that Muturi goes for further checks that revealed something more concerning. The tumor had grown significantly. Muturi went under the surgeon's knife again to remove the tumor that was impeding his everyday life. This was removed successfully, but after some time, Muturi started getting recurrent infections.
Like 2 weeks down the line now, he developed a cough that was not going. And we said, okay, fine. We had also been told in case he develops a cough, go to see a doctor, don't stay with him at home. So this time we went to another hospital, and they went and checked on him. And they said, okay, first, before we even start on any medication, let us find out what it is that is affecting him. So they did tests, and 2 days later I went to see him in hospital, and I find everybody is wearing PPEs.
But the news that the family received next would change their world forever.
So then, now the doctor who was seeing him, the one who had admitted him there, is the one who was asking us now, when was the last time he was in hospital? So we told him like 2 weeks ago he was admitted in another hospital and he was in HDU. And then he said, okay, yeah, that's where the problem came from, because what he has is a bacteria that is resistant to any antibiotic, and so we can just give him a concussion. You know, we'll try as much as we can, but I think they could see he was not improving, and I think he could also tell that, I mean, now that it cannot be taken care of, he actually advised me and told me, you know what, just take your husband home. And so we came home. And he continued with treatment for like 2 days he was quite okay, and then the third day now he just started going down. And by like 5 days he passed on.
Through this entire journey, Lisa was never told about AMR, nor why her husband was not responding to medication.
You know, Muturi was a fighter. You know, a person who, whatever he was told by the doctor to do, he did it to the letter, so that he recovers. You know, I think he had been sick for long, that he would look for anything that would turn things around. And you know, that is what actually used to make me even feel bad about it, that despite his fight, because he did all he could, he really tried. But despite that, and he had stayed with this congenital problem for all those years, he actually died at 58. He had stayed for all those years, and he survived. And then he goes to hospital where you think he's going to be cured or get better, and that's where he picks what kills him.
Lisa's husband picked a superbug in one of the most unlikely of places, at least according to public perceptions, and died from it. He was just 58 years old.
What does that mean? It means death. We see this a lot in practice, particularly in patients who are very ill, in critical care units, for example, who have been on a lot of antibiotics. They are at high risk for infections, and in the process of taking care of their sickness, a number of things happen. One, they'll get lines put into their veins to collect samples or to give them drugs. Your intact skin is very important for preventing infection. So the minute we have lines going in, we've broken that barrier of infection, and it's more likely that you can get an infection.
And when one gets such an infection, there's often no way back.
some of these common bacteria that cause infections become resistant to these commonly used and widely used antibiotics, then we severely restrict our ability to be able to treat any infection effectively. That's really the essence of it. And of course, if you don't treat an infection, and some of these infections are quite serious if not managed well, then you're going to lose people because they will die. The drugs that you have will not work on them.
52-year-old Dr. John Kariuki was lucky to survive a resistant bug that threatened to take him down.
I had a slip and fall, and I had a very painful time after I acquired a fracture of the hip joint. And I could remember myself approaching unconsciousness. And that's the time I called my wife aside and told her, I think I'm headed to the next heaven.
What started as a bathroom accident for the father of 3 boys turned into months of critical care in hospital. Even being a doctor in constant touch with AMR-related information was not enough to keep him safe from complications related to antimicrobial resistance. After numerous visits to hospital emergency rooms, Dr. Kariuki eventually asked for a culture and sensitivity test to be done. That is when the medical staff realized he suffered from a multi-drug resistant bug.
When you use broad-spectrum antibiotics, it means it's a kind of a shotgun therapy, where you're using one antibiotic to hope to cover a wide range of microorganisms. When I left hospital, I had incurred a bill of about $30,000 US. 3 million shillings. If I had done a culture and sensitivity testing, I'd probably have spent not more than 20,000 shillings. It is very expensive to be very cheap.
This is a war that we can be able to win by.
State and non-state actors insist that instituted policies can only work if there is a concerted effort towards their application and enforcement. The AMR fight cannot be won with professionals working in silos.
The One Health approach brings together the various sectors to work in unison so that these efforts are well coordinated and in that manner be able to achieve some impact. So that's really what we need to focus on. That's what the program that you talk about is that there must be leadership and stewardship provided by the top-level government.
Within the One Health approach wheel are critical cogs that will ensure the success of the intervention, such as the National Action Plan that is broken down to individual county action plans that encompass human, animal, plant, and environmental health.
Now, the National Action Plan has 5 major objectives, and it's for us now to decide among the 5 objectives of the National Action Plan to prevent and combat antimicrobial resistance, what are the most pertinent issues that we must address now, in the short term, in the medium term, and the long term. And I always advocate for what we call the low-lying fruits. What are the measures that we can take now and make a change or make a difference?
Sensitization of key populations, as well as presenting a united frontline from both plant, animal, and the environmental health, remain key objectives in the National Action Plan in the armory of those at the frontline.
We cannot deal with this, single-handedly within the health sector, because no matter what we do in the health sector, if we don't address the agricultural sector, then we will not achieve what we want. So the approach towards antimicrobial resistance is really to try to bring on board all those sectors that are involved.
Let us help by following the rules that have been set with respect to dispensing of controlled medicines like antibiotics, which should only be sold upon the production of a prescription. Let's take our roles as health educators, talk to the patient. I think if we take time to speak and engage our patients, they'll understand what this means for them now and in the future.
Others believe that leveraging on technology to introduce young audiences to the challenges posed by AMR and the impact of simple prevention measures will complement other ongoing sensitization efforts.
For the primary school going children and the high school going children, we are trying to just basically go to the school and sensitize them on issues of antimicrobial resistance. And we are also trying to use social media platforms just to reach out to that population that is usually stuck on the phone, trying to see what are the new trends, what is happening. So we are writing targeted messages that will help people know about antimicrobial resistance.
Also as an intervention and in recognition of the critical role that research and data plays in identifying solutions to potential problems. The Kitale County Hospital, where Dr. Zaituni practices, launched its first antimicrobial stewardship program in 2021, and this has gone ahead to do point-relevant surveys to monitor the use of antimicrobials in the hospital.
For example, in the veterinary section, we have the CABS application. It's a mobile application. You would wonder why we are referring to the animal health while I'm coming from human health. The antimicrobials that they use in the animal health are the same ones that we use in human health. So it is also important that we monitor the consumption in animal health.
There are other national interventions too that are recording significant gains against AMR.
We have also established a surveillance system. It's very hard for you to combat a problem whose magnitude you don't understand. So over the last 5 years, we've been setting up our national surveillance system. That has been done. We now are receiving data from about 14 laboratories within the country. And that for us is a big thing because then we begin to get our own local data that can influence even the treatment guidelines that we are asking our practitioners to adhere to. We are now beginning to see what the true burden of antimicrobial resistance is in the country, not just in terms of the bugs that are not responding to drugs, but also understanding what are we consuming as Kenyans, not just in human health, but also in the animal health. We are seeing volumes and tons of certain antibiotic, and when you look at it and you look at it against the demand, then you can see the correlation. Same to human health.
So for us in Kenya, we do have the Kenya Veterinary Vaccines Production Institute, known as KVVAPI, which produces vaccines for a number of common diseases that affect animals. And when we use these as farmers, when we use this as livestock keepers, then we prevent diseases. Once we prevent diseases, then we are not going to use antimicrobials. And in that way, we also somehow address the emergence of antimicrobial resistance. Other ways we actually have been training farmers around the country is proper hygiene measures put in place in the farms, ensuring cleanliness in the farms.
However, even with the best policies and enforcement, there has to be a fundamental shift within the population if the fight against AMR will be a success.
So when I look at our systems, when I look at our behavior, when I look at our practices, and I realize the willingness to change probably is not there, or the urgency to take action is also not there, not just at the policy level, but even at the local population level. And then you begin to count, like you can actually wipe out a quarter of this country's population within a year if we don't change the way things are being done. So the future is dim if non-action persists. But if we choose to change the way in which we behave, then probably we can begin to reverse the damage that we are seeing.
It is something that even the public has power over. So one of the things I'm advising the public to do is not to self-medicate, and even when they have medications prescribed by a practitioner, they need to finish their doses.
We can also improve on reducing the amount of antimicrobials we use by ensuring that our farmers feed their animals properly. They should use, it is recommended that farmers use wholesome feeds. They use feeds that have all the nutritive value that animals need. In this way, then the animals that we produce will be healthy. Healthy animals do not fall sick. When they don't fall sick, we do not use antimicrobials.
And therefore it's important they're professional organizations. We need to support their professional organizations. We need that advocacy at all levels, not only advocacy for the public, but advocacy also within the professional circles as well, so that people have a common understanding of what the problem that faces us is, the scale of this problem, and the actions that we need to take to be able to control the problem.
Today, many more continue to die across the globe from antimicrobial resistance. Deaths that can be reduced, deaths that can be stopped, but only if everyone plays their role.